obviously, as much as we can talk about it, there are always going to be patients that are not keen on the needle, and that's absolutely fine. No one's going to make you use a needle. So one of the alternatives, as you mentioned, is Trimix, or you can actually get our Prostatal gel, and that's an intraurethral gel. So this is an example of one here. So it's a pre-filled syringe. Yep, that looks a bit better. It's a pre-filled syringe with just a cap on it, and the gel is inside. You probably can't actually see it, but that's a gel inside there. And the idea behind this is you're not injecting it obviously through the skin, you're inserting it into the urethra and it gets absorbed through there. So the method of actual insertion, it can be a bit difficult. So I would recommend, again, the vacuum erection device to get a bit of stretch in the tissue beforehand. That can help you to be able to insert this gel. So maybe 5 or 10 minutes beforehand, use the vacuum erection device, get a bit of stretch in the tissue. Once you're ready to go, you'll have to hold the penis upright. I'll grab the gel, hold the penis upright. You'll pinch the glands, so the head of the penis, so that the urethra opens. You'll take the cap off and you'll insert the top of the syringe just inside the top of the urethra there. Now, this is only 0.5 ml, so 0.5 of a mil. Post-prostate surgery, your anatomy has changed slightly, so there's less stopping gel or otherwise from actually making it all the way into the bladder. So we need to do this very slowly. So once the tip of the syringe has been inserted into the top of the urethra there, you'll inject that 0.5 ml over about 20 or 30 seconds. And that's quite a long time when you're actually doing it. Again, I'd probably recommend the first one to be done with an injection therapist or with a doctor or someone that somewhat has an idea of what's going on. You'll need to hold the penis upright for at least a minute or so afterwards as well, and that'll help the gel to be absorbed. If you let it flop down, it's just going to fall out and not going to do too much. Now, all of that said, a massive advantage of it obviously is the lack of a needle, but it obviously comes with some disadvantages as well. So it does need to be kept refrigerated, which actually the Trimix needs to be refrigerated as well. On that note, inserting something that's refrigerated into the urethra can be a bit uncomfortable. So you would
Tim, just to interrupt you, we did just get a question through, someone asking, in general, is it better to warm Trimix before the injection as it comes from the fridge? And it sounds like you're suggesting, no, it has to stay cold in both instances. Is that right?
So the injections, the intracavernosal injection, so the one that comes in a little vial, you can let it get to room temperature, that's fine, but actually warming it up to body temperature may not be a good idea. It does need to be kept refrigerated. Depending on the manufacturer, when I say manufacturer, it'll be a compounding pharmacy. Depending on their practices and what they recommend, it may last about 6 months or so in the fridge. The Trimix gel at a similar kind of time frame, but that has to be refrigerated that whole time. Obviously, these come in separate use little syringes, so you take one out at a time and use that. The injections, I'd recommend to take the vial out, get it to room temperature, take your dose out and pop it in the fridge as soon as possible. Obviously, if you're using it to have sex or masturbation or whatever it may be, it might be sitting in the room for, an hour or so. That's also fine. It won't cause too much damage at that point, as long as it's not in the sun or in, a very heated room. It will be fine. Just pop it back in the fridge when you can.
That sounds good.
So I guess. Sorry.
Oh no, I've got a flurry of questions coming through, and I'm aware we've got about 4 minutes left. We're doing great. Let's see how many we can get through. And of course, anyone throwing questions in, I'm sure that there's a chance that we will do this again. Or Tim, of course, is available for consult or to get in contact with afterwards. We've got one through asking how effective the gel is compared to the injections. I think it'd be an interesting one to hear about.
Yeah, so that is also a massive disadvantage, unfortunately. So effectiveness-wise, evidence suggests for erectile dysfunction, the effectiveness is about 35 to 70%. So it might work in about 35 to 70% of patients. Post-prostatectomy is often lower than that, or on the lower end, I should say. So closer to that 35% hit rate, basically.